So welcome to today's Health Literacy Connection Cafe on Health Literacy in Canada. I'm Farrah Schwartz. It's nice to meet all of you from Toronto, Ontario. And Sophia, Wong, and I will be leading this session, this informal opportunity for us to connect today. I'm a manager of patient education and engagement at University Health Network, and also have been involved with the Canadian Health Literacy and Patient Education Network, or CHLPEN, for a long time, since it was started in roughly 2012. So we thought that this would be a great opportunity to, meet with others in Canada with this virtual gathering to just talk about what's going on across the country. And I do understand that some people who are trying to make it in aren't able to, so hopefully we'll be able to continue this in the future. Sophia, I'll hand it over to you quickly to talk a little bit also about your role.
Thank you, Farrah. And I see in the chat, actually, we also have a lot of our American friends joining who seems to be interested in the health literacy in Canada. So it's a good opportunity for us to learn from each other as well. And hello, everyone. I'm Sophia Wong. I'm the Patient Education and Engagement Capacity Building Coordinator, also at University Health Network. So I work with Farrah, and with that, I have been working with a lot of teams to really promote health literacy and help build their skills and capacity in partnering with their patients in their care. And so, yeah, we're really excited to meet all of you today and learn more about the work that you do.
Thank you. So today and I hope everyone can see the screen okay, these are the learning objectives for this session. So for all of us to have a chance to describe health literacy work taking place nationally or provincially in Canada, connect with 1 to 3 other individuals that are working in the health literacy field in Canada. So whether it's somebody that you've met before or people entirely new, it'll be a good opportunity for us to make those connections and have a good chance to talk, and then share learnings and best practices to adapt at the local or national level and identify opportunities for future collaboration. So this is one moment in time. There's so many opportunities that we'll have to work together to share knowledge in the future. So this is really about setting that up and checking in at this time. So we have a few session guidelines, and then away we go into rooms to start chatting. Most of you are already on mute, so thank you for that. I think everybody's got that one. So during what we want to do, we'd like this to be as engaging as possible. And so please send us your favorite local Canadian or local health literacy resources. So if there's anything that you found is a really good made in Canada solution, made in your province, that you'd like to share with others, send those our way so that we can profile them at the end. In the main room, so the room that we're in now, please do use the chat box to respond to comments, discussion, ask questions, and then we'll go into breakout rooms and ask you to use your microphones for discussion at that point. And cameras are welcome, but certainly not necessary if you prefer not to have them on. And then afterwards, of course, there are conference evaluations, I believe, so please do fill those in, and we'll also share some opportunities for networking for ongoing discussions. Sophia.
So in true Canadian nature, we all want to be represented. And so we thought about breaking us in rooms to represent the different areas of Canada. So some of you would be automatically assigned to the Atlantic provinces, Central Canada, the Prairie provinces, the West Coast, and the Northern Territories. And just to get to know each other, we'll give you 5 minutes just to share your name, how you're involved with health literacy, where in Canada do you live, and something that you like or already know about the region that you're assigned in the breakout room. So we'll give you 5 minutes to do that, and then we'll get back to the main meeting room and have more discussions afterwards. Hello, everyone. Welcome back. I'm sorry if you didn't have enough time to introduce each other, but don't worry. We'll break out again in a few minutes, and hopefully you can continue your conversation then. So, Farrah, would you be able to share your next slide?
Sorry, is it showing up all right? No. Okay. One more stack. Sorry, everybody.
There you go. Great. So I wonder, Farrah, if we should skip this one, or actually, you know what? This might still be a fun activity. So I know that there's a few of us who are not from Canada, but what we would like you to do next is to use Annotate. So this is a feature in Zoom, and for you to find Annotate, it would be on top of your screen. And then if you click on Annotate or View Options, you will see Annotate from the menu. So just like what we see here in the screen. And then from there, this box will pop up. And so you can add text or stamp, and we will be using this to continue our interaction for the next few slides. And so for the next slide, we'd like you to pin your location where you are in Canada. And for our friends in the US, if you can maybe, you know, since your map is not showing, just maybe show where you might be there in those white spaces, or any place where you'd like to identify just being in Canada. I see a lot of people favoring Ontario there. Okay, we're seeing a lot of different places and stars here, so which is great, just to see how spread out we are, and really that's how we can learn how different our practices are, or how similar they are in the different parts of our country. So as we mentioned, we would like you to go back again in the breakout room, and it will be the same rooms that you were assigned to earlier. And just to facilitate discussions, as I know a lot of us really wants to learn more about the work that we do in health literacy and how it could help us also benefit each other. These are just some guiding questions that you can start using in your conversation, but you can just focus on one. You do not need to touch on all of the questions, but if you have the time, that would be great. We will be using 20 minutes, Farrah, is that right, to have these discussions? And then just make sure that you assign one member of your group to report back on the discussion, just so we can also all learn from each other. So some of the questions you might want to consider talking about is, what is going well with health literacy policy, practice, or research in your jurisdiction? Or what could be done better? Or what is something unique to the health literacy in your jurisdiction or province, or what might be similar to the other Canadian jurisdictions? And what are your greatest health literacy support needs? So learning and networking. Again, we may learn from each other's work. And or how did your health literacy work shift during the pandemic? And I'm sure a lot of you are interested in this topic too. So yeah, we'll go back to our breakout rooms. You'll be meeting all the same people, and you'll have 20 minutes to discuss these questions and then report back to the bigger group afterwards. Thank you. Hello, everyone, and welcome back. I hope that you all had fruitful discussions in your own discussion rooms, in your own breakout rooms. And now I can't wait to hear how those discussions went. So I'm just gonna call us by our rooms. I think that when we did the breakout room, we lost the names of the Canadian provinces, but that's okay, because you do have a lot of American friends with us today. So can we have someone from room 1 share their discussions with us? And this is the group of Carol, Elijah, Katrina, Look, Michaela, and Sherry.
Hi there. Thank you for the clarification. I wasn't sure what our room number was. Yeah, we had a really nice discussion about the different resources and networks that exist in Canada specifically. I'm pretty sure we were all from Canada. Correct me if I'm wrong. A lot of the discussion around health literacy is that sort of as a concept, it's not maybe enough on its own when we're talking about patient education. that other sort of methods need to be, sorry, you're going to hear my toddler having meltdown in the background. Other methods need to kind of be partnered with it. So really including discussions around cultural awareness and practices, and also teach back, and making sure that that's really embedded in the way that we're working with patients and families and colleagues and peers. There was also, we discussed a lot about how COVID has really changed the landscape of the work environment and the work that's being done, and just the pace at which information has to be kind of spread to the public, and also the different kind of facets of that. So making sure that things are translated, but how are they being translated, and what is the message that we're really trying to get across. So that's really, in a very small nutshell, some of our discussions that we had.
Thank you. That's very helpful and very timely as well. Can we now hear from room 2? Anyone from Ashley, Diamond, Eleanor, Elishiba, Jennifer, Kurt, share their discussions with us?
We didn't assign anyone to speak, but I'll go ahead and kind of sum up our discussion. We really just talked about how we were disseminating information. Kurt shared a lot of good tips that he has learned within his field, as far as reaching out to the community, hearing what they need, the trust value that came from them, as far as he shared that, you know, they were kind of using more print materials and things like that, but that that wasn't working for a specific community that he was working with. And they, you know, told him to utilize radio, and that they had a local community radio, and that was going to be the best way to disseminate information. And I think that was kind of what we were just trying to gather, what everyone was kind of doing, and different opportunities or ways that we're able to learn how to make sure that we're translating information correctly, so that, you know, it's not necessarily being communicated in the wrong way unintentionally. So that was just kind of the focus of our conversation. And group, if I missed anything, please feel free to jump in.
Thanks, everyone. And I jumped into that group very quickly, and they were really talking about how translation accuracy is important, just because, you know, in some terms, one example that was used and shared in the group was the use of al menudo, if I can remember it right, in a perinatal class, I believe, and because it's the formal term, but that's actually mistaken as a soup. So the accuracy of translation is really important as well. So like when we promote plain language, how are we continuously promoting plain language when translation and interpretation is also included in that patient's care? So thank you for that. And so for room 3, anyone who'd like to share their discussions. And this is the group of Gary, Jonda, Kenya, Nicole, Sylvia, and Teddy.
I'm going to try and give it a shot here. This is Teddy speaking, and please feel free, everyone else, to chime in if I miss anything. We represented quite a diverse group. I am Canadian, but many of the group members were not. So it was a much more diverse conversation, and really interesting, different perspectives from different organizations that represent different communities. And so we talked a lot about misinformation and just the sheer volume of information, and how hard it is to be the voice of accuracy and amongst all that, and how to create messages and systems that speak louder than the extent of misinformation that's out there. And the resounding theme was being a part of the community, and being involved in the community, and being part of initiatives that exist in those communities, and really interesting, the conversation around misinformation, and that being a one-to-one conversation, and respecting people's views, and people's ideology, and working with that to recreate that information message in a way that's going to make sense to the individuals that you're speaking with, as opposed to being this is the right message, being this is the message as it relates to you and how you can see how you can apply it to your house. So a really nice shift in terms of not just being a voice of authority, but being a voice of community, and that was really lovely to talk about. Also, the shift to social media and the strength of social media in the health promotion field, and it's an area that we've dabbled in, but haven't necessarily jumped into the waters. And it was nice to hear how effective the upkeep has been, but that those tools are designed with the community members that they're meant to engage. So I think that's incredibly important to talk about as well. So that was the gist of our conversation.
Thank you so much, Teddy. That's a very interesting conversation you had there, and rightfully so. Like, misinformation is just so rampant, and so with health literacy, how do we address that? And so for room 4, anyone who'd like to share? Adazi, Andrea, Danielle, Ismatara, Judy, or Taylor?
Yes, I will go ahead and talk. And you are there to as an icebreaker, and you started sharing how you do with the University Health Network Center, like the patients learning, like peer learnings, identifying the barriers, and the learning through the peers is the one of the way to overcome some of the barriers we have. And all the participants was very diverse from different parts of the United States. We didn't have anyone from Canada, but Sophia, I think she was the representative of Canada in our group for the first part. And overall, we don't like, we are a very diverse group and has a diverse perspective about the health literacy. And in my perspective, it was the social determinants of health has a significant influence, and definitely health literacy depends on the literacy of that group. And we talked about like, as my previous group member said, like, who is explaining the dissemination of correct information in this era of social network. It is really hard to overcome the misinformation and disseminate the correct information, which is really important. And definitely social media, we are thinking that the elderly group of the people does not have the smartphone, so they are very underprivileged, or they have that strong barrier to reach the literacy. E-health literacy is also important. And we represent like rural and urban, so we have a different perspective in our discussion.
Thank you so much. I think you summarized really well. So yeah, there's really a lot of discussion about barriers and seniors. And I think one member of the group also identified that they're working with the city to really learn about their data to be able to address health literacy in their work. So that's wonderful to hear too. And our last but not the least, group room 5. So Fabiola, Deb, Brandy, Andrea, Farrah, or Nicole. Anyone like to share their discussion?
Nicole, do you want me to? And Brandy, I'll go ahead. We were, and Nicole, both of you, please jump in. So Nicole and I are both located in Canada, and the others on the group were chiming in from California, the US. So we talked about just the impact of COVID and some of the changes that have challenged people's health literacy, especially at the local level, and around things like hospital care, where people are not able to access the support that they normally would, and how this can really impact their wellness in a way that would be close to other conditions. That, you know, in Canada, we've had a lot of changes to how people can be with patients in the hospital. And so that has been detrimental to people's health and wellness. We talked about the benefits of COVID in terms of bringing people out, and Brandy from Safety Net shared that it's really engaged people in how they want information, and that they're using more infrastructure to engage and be heard about what they want, the information that they need for themselves and to share with others. So definitely a varied experience. And then one of the other things that we talked about, again at a local level, was opportunities to do more information translating and to leverage grants from other sectors such as Ministry of Immigration or other areas to, and really to work together to see about bringing health information that would apply across our area, our jurisdiction, so that we can address this gap altogether. Did I miss anything? Okay, excellent.
Thank you very much, everyone. And Farrah, do you want to share now the next steps for the resources and other opportunities to connect?
Absolutely. And thank you for taking us through that, Sophia. So what we did was we put together a couple networking opportunities that you may already know about. So if you know about these, then, you know, if you have any feedback or would like to engage, there's CHLPEN. And so the information on how to subscribe is there. And then if you're emailing the group, please make sure that you do it using the address. Sometimes we get bounce backs because of the 2 different email addresses. And of course, I would be remiss not to say that all you have to do is add a UN if you want to unsubscribe to CHLPEN, and please follow the same syntax. The Health Literacy Solution Center, I think many of us are members of, and I'm sure you've heard of throughout the conference. So definitely join, and you can choose how you want the communication to come to you. And then there are communities the communities tab, sorry, for option on the discussion list. And then the International Health Literacy Association is also doing a lot of exciting things, launching new chapters, and they'll be having an election coming up. So check out ILA if you haven't already. And I do apologize, it was much more challenging than anticipated to actually see the chat at all. So while we promised to put information in the chat, we have not done so because we don't know if it's been shared. But what we'll do is as soon as we're done and we end the screen share, we'll take a look and we'll pull out the information and see if we can post it somewhere in the conference materials. But in the meantime, Beth Mansfield, some of you may know Beth, did share these resources with everyone in the session. And so just great information on nutrition and health literacy, which is definitely an area where there's a lot of great discussion and shared interest. So as a next step, I'm sorry that we had technical difficulties and we weren't able to connect in quite the way that we'd hoped to. It was still really great discussion, and it was really nice to see those of you who we saw and heard from, and just to have a check-in. So it would be great to continue this discussion, and I think hopefully all of us have or will soon have a little more energy for this networking and for CHLPEN and to think about what's going on across Canada. And so to continue these important opportunities and work together. Thank you everyone for coming, and for those of you who do not hail from the Great White North, thank you for stopping in and just joining us today to discuss your health literacy work as well. Anything to conclude with, Sophia?
I think you did a great wrap up. So thanks everyone for your participation as well, and we'll continue to connect through the conference.
Thank you, everybody.
Everyone.